In this video, I want to talk about sinus lifts and whether or not you may require one. So what is a sinus lift and why would somebody require a sinus lift? So when we talk about sinus lifts, we're talking only about the top jaw. What happens, we have something called the maxillary sinuses, or the sinuses here that are inside our jawbone, and when we lose our top teeth, mostly the back top teeth, the bones start to shrink and the sinuses expand because the roots used to kind of keep them up pretty high. But when the roots are gone to extract your teeth, the sinuses kind of drop down, the bone shrinks, and then when we want to go to do a dental implant, what happens is the floor of the sinus might be in the way. Now, in the past, this was a deterrent to having dental implants. Thankfully, with advances in dental technology and procedures, it's no longer a deterrent. And there's three kind of ways we can deal with having that. Now, one of the ways is with advances in dental technology, depending on what type of procedure you're having done, there's an all-on-4 procedure, and these are people who are missing all their teeth. We can actually angle implants on an angle underneath the sinuses to avoid having any sinus procedure done. However, if you're not one of those people that are missing all their teeth and you're only missing a few teeth and you need implants back there, but the sinus is in the way, then the surgeon is going to talk to you about two options of doing a sinus lift. And what is a sinus lift? It's exactly what it sounds like. We're lifting the sinus to create enough height in the bone to allow us to place an implant. Now remember, this is only on the top jaw. And in order to do a sinus lift, there's two different types of sinus lifts. If there's not a lot of room needed, then the day that we're placing the implant, the surgeon can actually do a direct sinus lift, which means he will lift the sinus while placing the implant, place the implant, and everything heals just fine around that. And that's called a direct sinus lift. It's done the same day as the implant placement. Now, if there's a lot of lift needed and we need a lot of space there to maintain, we do something called an indirect sinus lift. And what that means is the oral surgeon will actually lift the sinus first, and then we'll wait 4 to 6 months for everything to heal, and then we'll place the implant into the bone that's created or left by lifting that sinus and filling in. So sinus lifts are a very common procedure and are normally needed for people who've had their top back teeth out for a long period of time and need to get an implant in that area and need it to go up and down, and the sinus has taken up that area. So in this video, I wanted to explain to you what a sinus lift is, the different types there are, and when it's necessary to have one.